All right, so you've all sent in some really interesting stuff, and today we're going to be taking a deep dive into dialectical behavior therapy, DBT for short. So this is going to be like your cheat sheet for really understanding what this therapy is all about, what it's good at, how it actually helps people, but without getting bogged down in all the complicated details and jargon. And we're mainly going to be using this PDF that was put together by Russ Curtis at Western Carolina University as kind of our main guide for this.
Yeah, this deep tag is really all about giving you that clear picture of DBT. And this is a therapy that was really pioneered by Dr. Marshall Linehan at the University of Washington. And it's a therapy that's really changed the game in a lot of ways. Yeah. When it comes to how we think about complex emotional difficulties and how we actually work with them.
So what we're trying to do today is really pretty simple. We just want to pull out the most important insights from this material and make sure that you walk away with a clear understanding of what DBT is and why it's such an important tool in the world of mental health. So let's jump right in. How does DBT, according to our source material, how does DBT view conditions like borderline personality disorder and complex PTSD? Like, what's their perspective?
Well, one of the things that's really interesting is that DBT looks at these conditions partly through the lens of emotional vulnerability.
Mm-hmm.
And the PDF we're looking at points to a possible genetic predisposition. So some people are just kind of wired to experience emotions more intensely and with a lot more ups and downs than others.
So it's not just about, what someone has gone through. There's a biological element that DBT sort of factors in as well.
Yeah, exactly. That's definitely like the first piece of the puzzle. But then the PDF goes on to highlight how important this thing called invalidation is, especially during childhood. And that's basically when, a child's feelings, their emotional experiences aren't really acknowledged by, by the people around them, or they're just kind of dismissed. And the PDF gives some pretty striking examples, like things you might hear like, there's nothing to cry about, or you're making a big deal out of nothing, or even stop complaining and just pull yourself together. And these kinds of messages can really teach someone that their feelings are wrong or that they don't matter.
Yeah, those phrases definitely, they definitely hit hard.
Yeah.
And you can kind of see how that would really shape how someone understands their own emotions. So how does DBT then actually approach working with someone, who has this kind of background and these really intense emotions? What are the core beliefs that kind of guide this therapy?
Well, when we look at the core assumptions of DBT, what we see is a really compassionate but also really empowering stance. So those initial assumptions are really key. Like, clients are doing the best they can. They want to improve. And then there's this one it's a little bit more challenging. They may not have caused all of their problems, but they still have to solve them. And I think that last one's really interesting because it avoids any kind of victim blaming, but it also at the same time, it empowers the person by giving them back that sense of agency that they need to move forward. So it's this delicate but really, really important balance.
Yeah, that makes a lot of sense. It's like acknowledging, the difficulties, but
Yeah.
but also nurturing that sense of, hey, you can actually make changes. The PDF also had some other assumptions that I thought were, I don't know, they were pretty direct, like almost reality checks.
Oh yeah, for sure. DBT, it doesn't try to sugarcoat how intense the client's experience can be. So there are assumptions like clients' lives as they are unbearable, and that speaks to that really significant distress that's often there. And then kind of stemming from that is, the assumption that they must learn new behaviors to, to manage these intense emotions and those really difficult situations, in a healthier way. So it's about recognizing that they need new skills to make their lives, more bearable.
And then there are the assumptions that focus on the therapy process itself, right? Like clients cannot fail at DBT and therapists need support. Let's talk about those a little bit.
Yeah. So the clients cannot fail at DBT assumption. That's really all about how flexible this therapy is designed to be. If one particular technique isn't working, then the therapist looks at how to change their approach. So it kind of reframes what might look like failure. It's not seen as the client's fault. It's more like a signal to try a different strategy. And then the therapist needs support assumption is vital because working with people who are experiencing these these really intense emotions can be incredibly demanding. And so having a supervision team, which we'll talk about later, is a really key part of making sure that therapists can actually provide effective care.
Okay, so we've got a better picture of how DBT understands these challenges and the fundamental beliefs that guide the treatment. But how does DBT actually work, in practice? What are the main strategies that are used?
Well, the cornerstone here is this idea of the dialectic, the dialectic of acceptance versus change. So it's about this constant balancing act between acknowledging and validating the client's current emotional state and their behaviors, and at the same time working towards change and helping them develop healthier ways of coping.
So it's not about just saying, hey, it's okay, just accept everything as it is. And it's also not about just pushing for change without really acknowledging, the pain and the difficulty of the present. It's that ongoing process of finding that middle ground precisely. So acceptance strategies, those involve things like the therapist showing empathy and validating the client's feelings and experiences, really communicating that, hey, I see you and what you're feeling, makes sense given what you've been through. And then you have change strategies, and those involve things like challenge and gentle confrontation. And the goal there is to help the client see those unhelpful patterns and start moving towards their goals.
And the PDF also talked about a technique called chain analysis. That sounds pretty detailed. What exactly does that involve? Chain analysis is a really cool tool in DBT. It involves a very, very thorough examination of a specific incident or a problem behavior. So you and the client would basically kind of dissect this whole sequence of events. Like, what were the initial triggers? What thoughts and feelings came up? What were the exact behaviors that followed? And then what were the consequences of those behaviors? And the main goal is to find those links in the chain, those specific points where maybe different thoughts or different actions could have led to a better outcome.
That sounds incredibly insightful. To really break down an event like piece by piece like that, you can really start to see those patterns and maybe where there might be opportunities to intervene differently, in the future. So with these strategies in mind, what are the overall goals of DBT? What is it ultimately trying to help people achieve?
So the primary goals are really focused on changing behavior. And the first one, which is, most crucial, is to decrease suicidal behaviors. And then after that, it's decrease therapy interfering behaviors. And those are actions that, that might prevent the client from really, participating in therapy and getting the most out of it. Things like, missing appointments or not engaging in the exercises. And then there's decreased quality of life interfering behaviors. And that could be, a whole range of things from substance use to, having trouble maintaining stable relationships or keeping a job.
Those all sound like pretty fundamental areas for improvement. What comes after you address those more immediate challenges?
So after that, the next two goals are more about, building those positive skills and developing a stronger sense of self. So you have increased behavioral skills, which we'll dig into a little bit later. And then there's increased respect for self. And that last one's all about, fostering that sense of worthiness and self-compassion and having a more positive view of themselves, which is so important for long-term well-being and for recovery.
Yeah, it's really helpful to see those goals laid out so clearly and actionably. And, I think for a lot of people, the big question is, does DBT actually work? And our source material, talks about the effectiveness of DBT across different issues. What were some of the findings that really stood out to you from the PDF?
Well, the evidence that's presented is actually pretty convincing. So the PDF points to research that shows how effective DBT can be in treating substance dependence, particularly in people who also have borderline personality disorder.
Yeah.
And there are studies by Linehan and Dimeth that are cited, and it also talks about positive outcomes for people struggling with binge eating, depressed and suicidal adolescents, and even older adults who are experiencing depression. So this suggests that the basic principles and the skills taught in DBT, they can be applied pretty broadly across different groups of people and across a range of mental health challenges.
Yeah, that's a pretty wide reach. It's not just limited to, BTD, which is often, what people think of first when they hear about DBT.
Exactly. And one of the things I found really powerful in this material was the data on the cost effectiveness of DBT. It's not, it's not just about whether people feel better. It also has really, really concrete implications for, for healthcare systems and how resources are allocated.
Yeah, the figures from the Columbia Area Mental Health Community Clinic were pretty eye-opening. Let's go through some of those for our listeners. What were the cost comparisons, between DBT and what they call treatment as usual, or TAU, across the different types of services?
Sure. So when you look at individual counseling, the cost for DBT was a little bit higher than TAU. But, when we look at group counseling, DBT was actually much more cost effective. But the really big differences show up when you look at the more, intensive and crisis-oriented services. So, for example, the cost of day treatment for people getting DBT was dramatically lower than for those in TAU.
And what about, those really critical and often very expensive areas like emergency room visits and psychiatric inpatient stays?
Yeah, that's where the data really highlights, the potential for DBT to save a lot of money in healthcare. So emergency room visits were much less frequent and much less expensive for people in DBT compared to TAU. And the difference in psychiatric inpatient days is really striking. So people in DBT, they spent far fewer days in psychiatric hospitals, and the costs associated with that were significantly lower.
Yeah.
We're talking thousands of dollars less per person each year.
Yeah, that's a huge difference. Psychiatric inpatient days went from $12,008 under treatment as usual down to just $2,614 with DBT. So that's a massive reduction. And overall, the total healthcare costs for 1 year were almost half for people getting DBT compared to the standard treatment.
Exactly. And this data really suggests that, even though there might be some, upfront costs involved in setting up DBT programs, the long-term savings, especially when it comes to reducing the need for those expensive crisis interventions and hospitalizations, can be really substantial. So it really underscores how important it is to invest in effective, skills-based therapies like this.
So we've seen that DBT can be both effective in helping people live better lives and potentially more cost-effective for, the healthcare system.
Yeah.
Now let's actually get into the specifics of, the tools and techniques that make DBT so impactful. Our source material talks about four key skill building areas. What are those core modules?
So those four modules are really the foundation of DBT skills training. You have mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. And these are taught in a very, very structured way to give people, practical, concrete skills for managing their emotions, navigating relationships, and just getting through those tough moments.
And what does a typical DBT skills group session actually look like? The PDF gives a pretty good overview of the format.
Yeah, so a standard DET skills group usually lasts for about 2 hours, and they meet once a week. And it typically starts with a mindfulness exercise to help people, get present and focused. And then after that, there's time for, reviewing, how things went the previous week in terms of trying to use the skills they've learned and also identifying any challenges they ran into. So it's a chance to share successes and also to troubleshoot any difficulties in a really supportive setting.
So it's not just about, passively learning information. It's about actively practicing and working through problems together.
Exactly. And then there's usually a short break in the middle of the session, and then the group moves on to learning a new skill. So this typically involves, a short lecture or explanation of the skill, often followed by an exercise, to give people a chance to actually practice it in the group. And then, after the exercise, there's time to talk about their experiences and ask questions. And the session usually ends with another mindfulness exercise to help everyone kind of transition out.
It sounds like a really structured and supportive environment for learning. And the source material also talked about some other things that are really important for making DBT work well. One of those was the role of having co-leaders in these skills groups.
Having co-leaders is considered really, really important in DBT skills groups. And the reason for that is it allows for, better management of the group dynamics. It brings in different perspectives on the material being taught. And it also provides a really important source of, mutual support for the therapists who are leading the group. And the PDF really emphasizes how important it is for the co-leaders to meet, both before and after each group session to plan out the agenda and then process, what happened during the session. So this collaboration helps make sure that the skills training is, consistent and high quality.
That makes a lot of sense, especially given, how intense some of the the issues that the people in the group might be dealing with. And then the idea of having a separate therapist, like a non-leader therapist, for those individual processing sessions, that also stood out to me. Why is that seen as helpful?
Well, that basically provides an extra layer of support, for the clients,
Mm-hmm.
and that can be really vital. So the skills group is mostly focused on, learning and practicing those DBT skills.
Yeah.
But the individual therapy sessions, ideally with a therapist who's, part of the DBT team, but not necessarily one of the co-leaders of the group, those can be used to, process individual experiences and work on applying the skills to specific situations that are happening in that person's life, and to address any more in-depth challenges that might come up for that individual. So it allows for a more personalized approach to treatment that really complements the skills that are learned in the group setting.
It really sounds like a very comprehensive and well-supported model of therapy. And the PDF also made this interesting point about, comparing traditional therapy with the DBT approach. And they really highlighted how DBT includes this supervision team for the therapist. Could you talk about why that's such a big difference?
Yeah. So Dr. Linehan's model of DBT therapy, as the PDF points out, it integrates not just the client and their individual therapist, but also this regular consultation team for the therapists themselves. And that's a really key difference because it recognizes that to provide effective DBT, especially with how intense this work can be, you need that ongoing support and peer consultation and a way to make sure that the quality is there and that the model's being followed. So this team-based approach is designed to minimize, the risk of what they call poor quality therapy. And it does that by building in this system of support and feedback and shared expertise for the therapists themselves.
So it's like having this built-in system of, checks and balances and continuous learning and support for the therapists who are involved in delivering DBT.
Okay.
Okay, now let's really get to the heart of DBT, those four core skill modules. And first up is mindfulness. What are some of the really fundamental concepts, within mindfulness as it's taught in DBT?
Well, in DBT, mindfulness is all about, choosing to focus your attention on the present moment, without any judgment. So some of the key concepts are learning to step back and observe your thoughts and your feelings and your physical sensations as they're happening without, getting swept away by them. And also to participate with awareness in whatever you're doing, really being present in that moment. And then another really important concept is this distinction between being right versus being effective. So sometimes, our need to be right in an argument or a situation can actually, make it harder to reach our long-term goals. And then finally, there's the understanding that thoughts are just thoughts. They're events that happen in our minds. They're not necessarily facts, and they're not commands that we have to, follow.
That's a really good reminder, that we have this ability to notice our thoughts without automatically believing them. The PDF also had a pretty short but interesting section on our true influence and how important it is for the receiving person to actually want what we're intending for them. How does that relate to mindfulness or to the broader goals of DBT?
That's a really insightful point, and it speaks to this idea that even when we have really good intentions towards other people, our influence on them really depends on whether they're open to those intentions, whether they're receptive. So this connects with mindfulness because it encourages us to be more aware of the context of our interactions with others and to be more skillful in how we communicate rather than just assuming that our good intentions will automatically lead to good outcomes. It means we have to be present and really tuned into the other person's state of mind.
Okay, let's move on to interpersonal effectiveness. Now, the PDF talks about this borderline dilemma in this context. What is that all about?
Well, the borderline dilemma, which is described, is avoidance of conflict versus intense confrontation. That really captures, a really common struggle for people who have a lot of trouble regulating their emotions. So they might find themselves, going back and forth between this strong urge to avoid any kind of conflict, no matter what, even if it means that their own needs aren't being met. And then, when they're pushed, they might react with these really intense and often very emotional confrontations, that can really damage their relationships. So it's this difficult pattern of either suppressing their needs or expressing them in ways that are ultimately really unhelpful.
So the main goal of the interpersonal effectiveness skills module is to kind of help people find that middle ground, a more balanced and skillful way of approaching their relationships.
Exactly. The overall goal is to maintain relationship and self-respect in all those interactions with other people. And this involves learning specific skills in areas like, asking for what you want in a way that's clear and assertive, saying no effectively, but without, damaging the relationship and coping with conflict in a way that's both respectful of yourself and the other person.
And DBT actually uses these really helpful and memorable acronyms to teach these skills, right? Dear man, give, and fast. Let's break those down for our listeners.
Yeah, absolutely. So Dear Man is all about maximizing your objective effectiveness, which basically means, getting your needs met in a particular situation. So D stands for describe the situation factually. E is express your feelings clearly. A is assert your wants or your needs directly. R is reinforce the other person for, listening or cooperating. M is stay mindful of what your objective is. A is appear confident, even if you're not feeling it inside. And then N is negotiate if you need to find a solution that works for both of you.
That's a really structured way to approach asking for something. What about give E? What's the focus there?
So give is all about keeping the relationship effective, especially when, what you're asking for might create some tension. So G is be gentle in your approach. I is act interested in what the other person's saying. V is validate their feelings and their perspective, even if you don't necessarily agree with them. And then E is use an easy manner, try to keep your tone of voice and your body language, calm and approachable.
And then fast is all about maintaining your own self-respect, during an interaction.
Right. So F is be fair to yourself and the other person. A is no apologies. If you haven't done anything wrong, if you haven't made a mistake, you don't need to apologize. S is stick to your values, stick to your principles. And then T is be truthful in what you're saying. So it's about, advocating for your own well-being and your own integrity within your relationships.
These acronyms are really practical tools for navigating social situations. The PDF also made a connection to the Karpman triangle. How does that concept relate to interpersonal effectiveness skills in DBT?
So the Karpman triangle, which describes the roles of victim, rescuer, and persecutor, and how people interact with each other, it's relevant because DBT wants to help people get out of these patterns in their relationships, which are often really unhealthy and they keep happening over and over again. And like the PDF says, getting caught up in these games, it almost always leads to hurt feelings and dissatisfaction for everyone involved. So by understanding these roles and how they play out, individuals who are learning DBT skills can start to develop, more direct and more assertive and ultimately more fulfilling ways of relating to other people and avoiding those destructive triangles.
That's a really insightful connection. Okay, let's move on to the third core module, emotion regulation. What are the key principles and kind of the overarching goals in this part of DBT?
So emotion regulation DBT is all about, really understanding your own emotions and learning how to manage them effectively instead of, letting them control you. So some of the main goals are to reduce your vulnerability to what they call emotion mind. And that's kind of like when you're, so angry that you can't think straight or so anxious that you can't focus on anything else. It's about increasing your ability to be mindful of your emotions as they're happening, learning to take opposite action when an emotion is unhelpful or leading you to do things that aren't good for you. And then, expanding your emotional vocabulary so you can better identify and describe what you're feeling, which is, the first step towards understanding it.
Take opposite action sounds a little counterintuitive. Can you explain how that works, in practice?
Yeah, sure. So the idea behind opposite action is that, sometimes when we're feeling a certain emotion, it makes us want to do things that actually just make that emotion stronger. So, for example, if you're feeling really, really scared, your natural reaction might be to, avoid whatever it is that you're afraid of. But in the long run, that can actually make your fear even worse. So opposite action is about, recognizing what emotion you're feeling and then choosing to behave in a way that's the opposite of what that emotion is kind of telling you to do. So the the PDS gives examples like, approaching something that you're scared of, or sharing your feelings when you're feeling ashamed and you just want to hide, or acting gently when you're angry and you just want to lash out. So it's about breaking that link between the feeling and that unhelpful behavior.
Yeah, that definitely takes a lot of conscious effort. And it probably feels pretty uncomfortable, at first. What are some of the other techniques or exercises that are taught in emotion regulation? The acronym PLEASE was mentioned in the PDF.
Yeah, so please is all about, being proactive in reducing your overall emotional vulnerability. And you do that by taking good care of your basic physical and mental health needs. So P stands for treat physical illness, taking care of any health issues you might have. E is for balance, eating, making sure you're eating a healthy and consistent diet. A is for avoid mood-altering drugs and alcohol. S is for balanced sleep, getting enough sleep on a regular basis. And then the last D is for get exercise regularly. So these really basic self-care practices, they have a huge impact on our baseline emotional stability and how well we can handle those difficult emotions.
Yeah, it makes sense. If we're physically run down, our emotions tend to feel a lot more overwhelming. The PDF also mentioned build mastery and using positive affirmations and keeping long-term goals in mind, within this module.
Yeah, so build mastery is about intentionally doing things that give you that sense of competence and accomplishment and control. So even small achievements can really boost your self-esteem and make you feel more capable, and that can then reduce your vulnerability to those negative emotions. And the PDF suggests things like, doing something nice for someone else or starting to learn a new skill. Positive affirmations are about, choosing positive statements about yourself and repeating them. And the key here, as the PDF points out, is to pick affirmations that you can, at least somewhat believe and maybe even try to picture them in your mind to make them more powerful. And then finally, keeping your long-term goals in mind,
Yeah.
that can give you a sense of purpose and direction, which can help you get through those, short-term emotional challenges by reminding you of what's really important to you.
Okay, so we've explored mindfulness, interpersonal effectiveness, and emotion regulation. And that brings us to the last core module, distress tolerance. And this one sounds like it's really all about, how to get through those really, really tough moments without making things worse.
Exactly. Distress tolerance skills are designed to help you cope with difficult situations and really intense emotions in the short term, without doing things that are harmful or destructive. It's about learning how to skillfully survive a crisis without making things worse in the long run. And the PDF emphasizes this idea of distracting, not denial, as a key strategy.
So how is intentionally distracting yourself different from denial in this context of managing distress?
So distraction in DBT is about consciously and temporarily shifting your attention away from whatever's causing you distress, whether it's the situation or the intense emotion. It's a deliberate coping skill that's used to help you get through, a particularly overwhelming moment when you might otherwise, do something that you'll regret later. Denial, on the other hand, is often unconscious, and it's this persistent avoidance of reality that can have negative consequences in the long run because it prevents you from dealing with the underlying issues. So distraction in DBT is a short-term strategy to help you kind of ride out that intense wave of emotion, whereas denial is more of a pervasive and often maladaptive way of just avoiding reality.
Yeah, that's a really important distinction. So what are some of the other specific distress tolerance techniques the PDF talked about? Self-soothe using your five senses.
Right. So self-soothing is about, intentionally engaging your five senses to kind of bring yourself comfort and a sense of calm when you're feeling distressed. So this could involve things like, taking a warm bath or holding something soft, that's touch, or savoring a favorite food or drink, that's taste, listening to calming music or nature sounds, that's hearing, using aromatherapy or lighting a scented candle, that's smell, or looking at, beautiful artwork or spending time in nature, that's vision.
Yeah.
So it's about, finding those sensory experiences that can give you a sense of grounding and relief in the moment.
And then there's the acronym IMPREVI. What does that stand for, and what kind of skills does it include?
So improve is another good acronym for improving the moment when you're in distress. It's just making it a little bit easier to handle. So yeah stands for imagery, using positive and calming images in your mind.
M is for meaning, finding some positive meaning in the difficult situation, even if it's just, the chance to learn and grow from it. P is for prayer, connecting with, your spiritual beliefs or something bigger.